Good morning, everyone. It's a great privilege to be here as the moderator of the first session. My name is Bridget Wills, for those of you who don't know me, and I'm a clinician researcher with a lifelong interest in dengue. Could I ask the three presenters for this session to come up to the stage? It's a little bit of an obstacle course to get here, and it's just easier if everybody comes up at the beginning. Then we'll have three presentations of 20 minutes. You have to go round. So we'll have three presentations and then take questions at the end. So if I can ask...
Thank you, Britt, for the presentation, and thank you for Adam and Steven for the invitation. It's a pleasure to be here with friends and also with Alberto, my former mentor in Brazil, in Oswaldo Cruz Foundation in Salvador. And I present some data about the Brazil epidemic in 2024, and also the data that we generated based on the several studies in real-world evidence in Brazil. This is my disclosure. I have two projects that founded by Takeda, and also part of the Global Dengue Steering Committee in Brazilian Steering Committee for vaccine. I want to point here, this is the data that generated that in the last 2 years you have the daily global, the high temperature that you register in the world, and this is 2023 and 2024. And this is very impressed how the climate change impacting the dengue epidemic. And this is, you bring this change for Brazil. You can see these different colors in the lines, these different regions in Brazil. And I like to point especially the south and southeast regions that have this 3 years of increase of the annual mean temperature in these two regions. This is very important for putting the context what occurred in Brazil in 2024. And this what occurred in 2024 is the worst year of dengue in Brazil history. You never experiment this emergence that occur in your country. It's more than 6.6 million cases, more than 6,000 deaths. Dengue in Brazil 2024 killed more people than COVID-19 and TB. It's the leader of deaths related to the infectious disease in Brazil in 2024. The projections from Ministry of Health, the scenario it's 2 million cases, 3,000 deaths, but suppress these numbers and this worst epidemic. In 2025, you have more than 1 million cases, more than 1,000, and this is the new partner of dengue in Brazil. It's different from the last decade. Nowadays, you have more than 1 million cases and more than 1,000 deaths in Brazil. This is a new scenario. And the scenario changed because the dengue go to the south, especially in the southeast and the south of Brazil. Also, you have a big dengue and chikungunya epidemics in the Argentina, Uruguay, Paraguay. And this probably is related to the increase in the temperature in the globe, but also in Brazil. And you can see the map, the dengue cases and mortality concentrating in the southeast, south, and middle east of Brazil. You know that what you did in the past not control the vector, and you need intervention. You need more innovation, and in this context, you need the innovation, the vector control, and also the immunization to do better with the prevention. And nowadays, you have Brazil lead too many innovation in the vector control. Now it's a public policy was introduced in the national program, the Wolbachia strategy. And also Brazil is the first country that support mass vaccination for adolescents between 10 to 14 with TAC 003. I will present some data about these new interventions, and I'm former director of Brazil Immunization Program and Transmissible Disease Program in Brazil in 2018, 2019. And during this time, Albert convinced me that Wolbachia maybe is a good option, and also he began a trial in Belo Horizonte to prove that Wolbachia can be applied. And you decided during the time that stay in the Brazilian Ministry of Health to do a implementation in one city. It's Campo Grande, it's my city, and this is a city that have 90,000 population, and you begin this implementation in 2019 until 2023. You release more than 100 million mosquitoes, and this is first results of the introjection, and you show that the Wolbachia was stable in the Campo Grande city, and also 87% of the city have these results, have a good cover of WML introjection. You can see in the right map, the green and the yellow have high cover of Wolbachia in the city during the time and become very stable during the time. You can see in the figure D. And also, you compare based on the incidence data. It's an interrupt time series analysis that compared Campo Grande dengue incidence with 3 major cities, Ponta Porã, Três Lagoas, and Dourados, and you show a reduction of 55% of the dengue incidence after the introduction of this strategy in Campo Grande. Have a dose response, have some areas that, small areas that you didn't have didn't report a high frequency of Wolbachia in Aedes aegypti, and you can see that when you have more Wolbachia, the prevalence of Wolbachia in Aedes aegypti, you have a high efficacy of reduce the dengue incidence in this area. And I want to now to move for vaccine. You have this collaborative study with the Takeda. It's a study that you perform in the city that 200 kilometers from Campo Grande in the same state, have a population of 240,000 people, and you plan to vaccinate 60% of the eligible population to receive the vaccine between 4 to 59. And also it's an interrupt series analysis for evaluate the impact. In 6 months, you vaccinated more than 90,000 people for the first dose and 37,000 people for the second dose. You have 2 anaphylaxis cases, 1 vaccine like dengue fever reported, and in the next year, you have the analysis of the study. You needed at least 2 seasonality to perform the analysis. And you have some lesson learned from this massive vaccination in 6 months. You needed the communications a key, especially after the COVID-19, but also you need to give access to the population with the extramural immunization. And you have this card that announces the dengue vaccine, and you go to the supermarket, pharmacy, gym center, university. The acceptance is very high, but the people don't want to go to basic units to receive, to last 30 minutes, 45 minutes to receive the vaccine. And this is the first results. It's under review also. It's adverse event follow mass immunization. You have 2 anaphylaxis that I already comment, grade 1, 2 Guillain-Barré syndrome. It's difficult to prove that's related to the vaccine because also you have a dengue seasonality when you perform the mass vaccination in Dourados. The no serious adverse events decrease during the time, and in the first and the second months you have more report of no serious adverse event. You have this dengue-like disease. You sequence this. This is just in the beginning of the mass campaign vaccination. The same time you have a dengue seasonality in January, and the surveillance become very worried because you have the first time in the last more than 10 years that you have a dengue serotype 4 in the city. But when you sequence this, it's the same sequence of the vaccinal virus, and this already be reported in the clinical trials. You have some viremia post-vaccinated, and you identify also during the mass campaign. The challenge here is how to perform the surveillance when vaccine also can generate some like dengue vaccine cases, and how you can do surveillance by serotyping in this area when you have the outbreak and also mass vaccination. Also produce some data related to the seroprevalence in this age between 4 to 16. Because you do this mass vaccination, it's good to understand what the prevalence of this of dengue in this specific population, because it's the same population that Brazil support the mass vaccination, and you see a trend. You have an increase in the seroprevalence of dengue in this specific city in Brazil, in the Middle East, the Dourados city, that already circulated a lot of dengue in the past. In the adolescent between 13 and 16 years old, the prevalence is close to 30%. Brazil begin this dengue vaccination campaign. It's not for the entire population. It's only select cities that, because didn't have enough vaccine to offer to entire population, you choose age between 10 to 14 years old because it's you have more data, especially for the clinical trial. We respect about this age group, but also Brazil use a specific strategy to select some cities that it's a urban area with more than 100,000 people, high incidence in the past, predominant of serotype 2 because the efficacy of the vaccine is high for serotype 2. And this is how the Brazilian immunization program select this specific city to implementation this program. You continue with this program, but this gives us an opportunity to evaluate the effectiveness of TAC 003 in this specific age population in São Paulo state. São Paulo is the large state in Brazil. 30% of the doses of TAC 003 go to this state, and have a big epidemic in 2024, especially in the cities that didn't have dengue, and nowadays, because all the increase in the temperature, you have more dengue cases. You can see in the left panel the dengue cases, the vaccination, and the dengue virus serotype. You can see that you have a few cases after the second dose. This is the main limitation of this study. You didn't have enough outcome to evaluate the second dose of the vaccine. It's also good to note that in the end of the year, in the beginning of this seasonality, you begin to have serotype 3 dengue. And for this specific analysis, it's good to focus on dose 1 for TAC 003, and also all these results is not related to specific for a serotype, but for the dengue, confirmed dengue case. These are the cities that was implemented the dengue mass vaccination, and this is a test negative case control study in the adolescents that eligible in the Brazilian immunization program, the period between the beginning of the vaccination until the end of the year, and the case definition, it's a positive NS1 or RT-PCR. It's good to note that you have a few RT-PCR, between 500, that's impossible to generate the effectiveness related to the serotype. This is a limitation. The majority of the cases in control came from NS1 test that do not provide serotype. Use the National Surveillance System and also National Health Data Network. You'd use a mixed effect logistic regression. The primary outcome is effectiveness against symptomatic virologic confirmed dengue, and the second, effectiveness against hospitalization virological. I not go deeply on this, but have a small difference between the case and the control, and that's the reason also you do sensitivity analysis to adjust for this. The case definition is fever and have an NS1 at least 5 days before the beginning of symptoms, but you perform some sensitivity analysis, include IgM, also 7 days of symptoms. This is the results of your study, probably published in the next 1-2 months. You are accepting the Lancet Infectious Disease. For symptomatic virological confirmed dengue, you have effectiveness about 50%. For the second dose, 61.7%. And for the hospitalized, for the first dose only, because didn't have enough outcomes for perform the analysis for second dose, you have effectiveness about 6-8%. It's good to note that I read comment. São Paulo is a state that dengue become more frequently in recent years, and probably the prevalence of in this population is lower in comparison with Dourados, that is 30% in this specific age group. You have some also you can understand that the protection begin after the first 7 days of the first dose. You can see this in the crude and the adjust analysis. And also, as a comment, you perform some sensitive analysis, included more NS1 RT-PCR until 7 days of symptoms. Also, you included the IgM test. You see a decrease in the effectiveness, a small decrease in symptoms, not only fever, and also epidemic time model. Use in the hospitalization effectiveness results, you have more stable data, but the results is similar, independent of the sensitive analysis and the adjust. This gives us the model is very robust, and probably the results is true. This is the sensitivity analysis, and I want to point that after 19 days, you see some drops in the effectiveness, and you don't know why occurred this drop. You don't know if when immunity or because raising dengue 3 prevalent. You see in the end of the 2024 this increase of the dengue frequency in São Paulo state. You need more future data to understand this. And this is the main conclusion. TAC 003 demonstrates that it's effectiveness against symptomatic hospitalization dengue adolescent. You see a really protection that begins after 7 days. And also you see the effectiveness remain consistent across sensitive analysis, especially for hospitalization. You see this decrease, and also your suggestions, you can consider the use TAC 003 and maintain 2 doses. This is the last slide, sorry. Future plans, you assess the dengue effectiveness in 2024, especially for São Paulo, because you have this increase in the dengue 3 in the population. Also, it's important to evaluate the impact of the second dose using that data from 2024, but also you have opportunity to understand the waning immunity use São Paulo data. The other study that you just analyze in this second semester is the real-world data analysis from Dourados, the effectiveness analysis from Dourados, because from Dourados you can analyze different age groups, but also serotype-specific analysis. And this support the policy from Ministry of Health. I would like to thank my team in Brazil, but also co-lab that collaborate with the Volvac study, but also the effectiveness study. Thank you, and sorry for 1 minute delay.